Everybody, we are up for a great treat right now because we have Dr. Todd Bourne with us from Allergy Research, ending our day. We saved the best for last, Dr. Bourne.
Thank you.
And he's going to be talking a little bit about hydrogen water today and the benefits to our health by utilizing this therapy. So I'm going to step back. I'm going to let you take this away. Thank you so much for being here today.
Sure. Thank you for inviting me. Want to thank the Weiner Wellness Center and Nutritional Frontiers for inviting not only Allergy Research Group, but also me to come and talk to you today about the benefits of molecular hydrogen, which we call them, well, at least I call it the master redox balancer. I'm Dr. Todd Bourne. I'm the Director of Product Development and Scientific Advisor for Allergy Research Group, and I'm in private practice as well. So I get to be able to see patients and then also use nutritional interventions every day. So for those of you who aren't familiar with the company, I'll just kind of give a brief overview of who Allergy Research Group is. They've actually been around for 42 years now. They were first founded by Dr. Stephen Levine, who is a molecular geneticist. He founded the company in 1979 because when he was doing his postdoc in molecular genetics, most of his research was on mushrooms and at UC Berkeley, and he was becoming very sick and chemically sensitive. At the time, he didn't know. And it didn't matter whether he took a supplement or medication, everything was just making him react. So he thought, I'm going to actually just develop my own hypoallergenic supplement company, which he ended up founding in 1979. And the whole supplement industry in the United States can thank him for bringing things like buffered C, 5-HTP, melatonin, and a few other products to the marketplace, nattokinase. He was the first supplement company in the United States to carry a lot of these products. And he actually lives about an hour and a half north of me, and still talk to him pretty regularly. We use unique and innovative products. We have over 250 products that are evidence-based, research-based, clinical-based. We use all third-party testing with certified independent analytical laboratories doing potency, purity, microbial, heavy metal. We test for constituents, botanicals. So the end product you're actually getting, that what the subspecs panels actually say, you really know that's what's in there. We are NSF certified, GMP registered, and an FDA inspected facility. Most of our products, we try to make them as hypoallergenic as possible, even down to the excipients, the other ingredients, the flow agents. We try to make them as clean label as possible. Many of our products use branded ingredients. Those can be things like highly bioavailable forms of turmeric or things that have actually been used in clinical trials versus just a plain old, say, B6 or something like that. We don't necessarily tout ourselves as industry-leading customer service. This is feedback from what we've received over the years, even from our distributors, and they just love our customer service and our tech support personnel. We also have a large educational platform for doctors and patients, as well as consumers. We have a focused newsletter that is research and evidence-based that comes out quarterly. It's about 16 pages. We have paper and digital versions, as well as a monthly webinar that's always given by an expert in their field. And then we record those, and then they're available for free for a month. After that, you have to be able to have a practitioner password to log into the website to access them. We also have a blog that is also evidence-based, so everything's referenced back to PubMed articles. So enough about the company. Let's talk about, this will be essentially a crash course in the use of molecular hydrogen, and there are over 1,300 studies in PubMed, the kind of the monster database for publications for science. But I'm only going to really talk about most of the human clinicals in really just a sweeping overview. So I'll go relatively quickly, but a lot of this information is readily available even via our company or just PubMed themselves. So what is molecular hydrogen? A lot of people know what hydrogen is. It's the smallest known molecule in the universe, but molecular hydrogen is two hydrogen atoms put together. And up here where I have 1 part per million equals 1 milligram per liter, which is about 5 millimoles. The units vary by studies. That's why I'm kind of putting in, because some of the studies are in parts per million, some of them are milligrams per liter, some of them are in millimolar units, so it kind of all depends. So how it's made is, we actually just a distributor for this product. We don't make this product. And it's a patented process by the man who created it, where you take magnesium and you And like I said, a small molecule. And what's nice about it being that small is that it can so what it does is it neutralizes the hydroxyl radical, which is a very strong or potent toxic oxidant to the body. It's just a natural byproduct of biochemical reactions. It turns on antioxidant detox enzyme pathways via protein transcription. So one of the pathways is Nerf2, and for those that may be in the know, or whether it's your practitioner or a well-informed consumer, is that Nerf2 has been in the news the last 5-10 years because it is bound to what's called keep one in our body. If you give certain nutrients or exercise or healthy foods, botanicals, molecular hydrogen, you can turn on Nerf2, which gets released from keep one and activates what's called the antioxidant response element, which turns on our body's own endogenous antioxidant mechanisms, produce glutathione and these other things. So for some of these studies where we don't see antioxidants, exogenous antioxidants have any beneficial effect, it may be because they're actually not activating Nerf2, but molecular hydrogen does activate it. What's great, right, is that it's very anti-inflammatory. It reduces these inflammatory cytokines, again, important, as we'll see later, for certain autoimmune diseases. And it's a signaling molecule for other mechanisms. The reason I call it the main or this master redox balancer is that it, besides the hydroxyl radical, it's also quelling peroxynitrite, and these are very damaging. This oxidant is very damaging to the cardiovascular system and kidneys, and it's really quite pervasive, and it has a negative feed-forward effect where it starts causing other damage to tissues and the cells. Well, what's amazing about the molecule is that it knows innately to not neutralize weaker biologically necessary oxidants like nitric oxide, right, which you need for vasodilation, or hydrogen peroxide, which your cells produce neutrophils to inject into bacteria and kill them. But if it's too high, these oxidants, which can become a problem, then the molecular hydrogen will actually neutralize them, only when they're in excess though, not when they're in normal range. It does nothing if they're deficient. It upregulates some of those a little bit, like nitric oxide. This is a great summary paper for the heady listeners of our audience if you want to read a really heady paper on the mechanisms of molecular hydrogen. And this kind of looked at molecular hydrogen and exercise and how they benefit all these various aspects of the human body, right? Antioxidants, vascular, brain, mitochondrial, inflammatory. And you see that it's upregulating all of these, it's downregulating the inflammatory response, improving oxidative stress, helping with tissue damage, etc. So, it really can't be understated how important this and how necessary this nutrient is. Let's look at actual human studies besides the mechanisms. So, for example, here was a study, let's see if I can blow it up a little bit so you can see it better. Here was a human study where they looked at individuals who had rheumatoid arthritis. A very small trial, but a trial nonetheless. It was open labeled, so there was no placebo. And these were 20 individuals who had rheumatoid arthritis, and they had them drink 530 milliliters of water containing 4 to 5 parts per million every day for 4 weeks. Then they had them stop, and then they had them drink it again for 4 weeks. And during these 12 weeks, they were measuring different parameters of the inflammatory response, like this urinary 8-hydroxydeoxyguanine, which is a urinary marker for DNA damage. And they looked at disease activity, looking at C-reactive protein levels, etc. And they actually also looked at, I don't have it highlighted here, but they looked at something called cyclic citrullinated peptides. And these are very specific and sensitive inflammatory markers for rheumatoid arthritis. And I treat a lot of autoimmune disease in my practice, and sometimes these CCPs are difficult to get down. The higher a level of CCP someone has, the worse prognosis they have over time for RA and the more tissue and joint destruction that they actually have. So the molecular hydrogen, which was interesting, in 4 out of these 20 patients, they went into a complete remission by just drinking hydrogen water. They didn't change any other aspect of their life. And anybody who knows someone has RA, or who have RA themselves, or doctors who treat RA, it can be difficult to get people in remission. But just by drinking water, hydrogen water, they actually went in remission. And then the rest of them actually had significant improvements in their quality of life and disease parameters from subjective findings. And then some of these objective parameters as well, the blood tests also improved. Psoriasis, this was a placebo-controlled psoriasis study in 41 patients. This was not, and they were followed for a year, so a fairly reasonable time frame. They did not drink hydrogen water, but instead they were immersed in hydrogen water baths. These are really only probably, useful in studies in research institutions, because it'd be hard to fill a whole bathtub and throw in a bunch of hydrogen tablets. It might be cost prohibitive for people. But what's interesting about this study is 21 out of the 41 patients were resistant to topical corticosteroids and calcipotriol, which is the pharmaceutical active vitamin D that you can use topically on psoriatic lesions. 10 out of 41 were resistant to ultraviolet B phototherapy. 3 out of 41 were resistant refractory to methotrexate, and 7 out of 41 were refractory to systemic retinoids. So these are pretty typical, common, conventional treatments that these individual 41 patients had failed these therapies. So what they did was they just immersed them in this bath, right, 1 part per million. So not even very much, particularly when it comes to oral dosing. Just 10 to 15 minutes every day, every 3 days for 8 weeks. And then they looked at all these scales, improved psoriasis area index, and which is called a PASI score. All these other scores improved in all the patients. 6 of the 41 actually either discontinued their medications or they dropped their dose. And case studies have showed molecular hydrogen or IV and also improved psoriatic symptoms. And I can say my psoriasis and psoriatic arthritis patients, they do better when they drink hydrogen water. Let's look at adjuvant cancer support, right? It's not going to treat cancer itself, but it certainly can help those who, for example, are receiving radiation treatments. So much of the damage that happens with radiation is due to this hydroxyl radical, which we know molecular hydrogen can quell. And what it partially does, it indiscriminately damages cell membranes, proteins, DNA, tumors, things of that nature. So what we saw were animal and cell studies in vitro, they did see protection with radiation or chemo, where these animals didn't have as much immune dysregulation, gastrointestinal problems, cardiovascular problems, like the taxanes can cause a lot of problems. And they're great chemo drugs. Some patients have to stop at taxanes because they have cardiotoxicity to them. Same with kidney problems and reproductive problems. So when we saw this, again, these are animal studies, molecular hydrogen one gave was with the cisplatin, the kidney problems, nephrotoxicity, weight loss, and mortality did not adversely affect the tumor growth. So in other words, these individuals still were able to receive the chemo, tumors shrunk, but everything else was protected. And that's important when it comes, if you're an alternative healthcare provider or integrative medicine, and the oncologist doesn't necessarily want their patient on something that they don't know if it might interfere with their treatment, which makes sense. So here are studies, and we'll go through some other ones that show that it doesn't interfere with treatment. And studies here, human studies, have shown that pre-treatment, so prior to radiation or chemo, that you can have benefits. There have been clinical studies, but these case reports. And here are the references, so I'm not just making stuff up. So here was a human study. So if you looked at a randomized, double-blind, placebo-controlled trial of 49 patients who underwent 6 weeks of radiation for liver cancer or liver metastasis, and anybody who sees cancer patients, is that once the tumor cells, the mutagenic cells are in the liver, right, there's all that blood flow, it gets disseminated through the body. It's not a great prognosis. Tumor cells, they get thrown, malignant cells get thrown all throughout the body, and it can be a rough way to go for many people. So here was a test in 49 study in 49 patients where at the beginning of the first day of radiation, they were given 2 liters of molecular hydrogen water, and here's your millimolars. And they were also told to consume 200 to 300 a pump when they wake up, and then 100 to 200 every few hours. So it's a lot of water to drink, but again, this is a study. And what they saw was that there was significant improvement in the quality of life from week 1 all the way to the end of the study versus the placebo group. So obviously the placebo group didn't know whether they were drinking an active component or just plain water, and vice versa. They showed that there was less appetite loss and less taste disorders from the treatment. They had improved antioxidant status at week 6. And what this was the key, at least for me when I am doing adjuvant cancer care, is that the treatment, the radiation treatment, was not impeded or impacted in a negative way whatsoever from the molecular hydrogen, when in fact they actually did better versus people who did not receive the hydrogen. So this is important for if an oncologist doesn't want the patient to take these things, you can show them these studies which show safety and efficacy. They also looked at 3-month follow-ups that similar response to radiation, no progression of disease. So that's a good thing, right? You don't want the disease to progress. And no differences in liver function tests or blood counts, which is also good because we want to make sure that we're not harming that patient. What about neurodegenerative diseases? Another big bulk of my practice. I see a lot of neurodegenerative patients, and here was a randomized, double-blind, placebo-controlled trial, where a small trial, a trial nonetheless, where they had 18 patients on Sitamet, levodopa, and these were Parkinson's patients. And anybody who has Parkinson's or treats it know any incremental improvement in symptoms, particularly if you've had it for a while, and you've got the pill roll and the shuffle and the muscle rigidity, etc. Maybe even trouble speaking or swallowing. Any improvement is worthwhile. So here what they did is just gave these subjects 500 milliliters of hydrogen water twice a day for 48 weeks. So a long trial, almost a year. And what they saw was small but significant improvement in the unified Parkinson's disease rating. And the placebo group actually progressed. And here is a trial that should be ending, I think, sometime this year, where it was multi-center, across Europe and I believe North America. But they looked at 178 patients and they followed them for 5 years. And they were going to see 6 years, and they were going to see, it was a 6-year study to see how they were going to do by drinking 500 milliliters of molecular hydrogen. So we'll see. It'll be interesting to see when this study comes out sometime next year and what the results were. But I have my patients drink it. And for me, I'm not really into animal studies. I'm not into in vitro studies. And the reason that is because most of the time, what we see in animal models doesn't translate to humans. But whenever I come across a study where something is pretty impressive to me, and I'm a pretty incredulous, skeptical person anyway, then I like to see it. So here are mice, and this was a study where they basically induced Parkinson's disease in both sets of mice. One, they gave nothing, and just plain water, and then one they gave molecular hydrogen water. And my apologies to the animal lovers out there on one of them, that this is a little hard to watch, but you'll see how it goes. So what they did was they injected them with this 6-OHDA and gave them Parkinson's symptoms. So you see a lot of the apathetic movements, confusion, falling around, what happens to them. Now let's see what happens to the mice, the mouse model, when they actually treat them. So they gave them molecular hydrogen for a month. Then they gave them the same injected thing to induce Parkinson's, the same toxin, completely normal behaving mice. And you wouldn't even know that they essentially had Parkinson's. So to me, this is a great animal study, and so that motivated me enough to use it in my neurodegenerative patients. So here's just kind of schematics, because we'll talk about also how metabolic and liver diseases, since there's quite a bit of overlap, so I bundled them together just for simplicity, and these are just schematics of all these metabolic disorders, contributing factors, what happens, when all the problems, and then, as years go by and people are taking care of themselves, with cardiovascular diseases, there's different liver diseases, particularly non-alcoholic fatty liver disease, which is reversible, non-alcoholic steatohepatitis, which is not typically reversible, but you can do slow it down and improve what the hepatic function is left, because hepatocytes do degenerate. So let's see if molecular hydrogen can help metabolic syndrome and type 2 diabetes. Well, here was a study. It was a crossover trial in 30 people. It was randomized, double-blind, placebo-controlled. Either they had type 2 diabetes, those were 30 patients, or 6 patients had impaired fasting glucose, impaired glucose tolerance. So basically pre-diabetics. What they did was they gave these individuals 900 milliliters of hydrogen-rich water, a pretty low dose, right? 1.2 parts per million is not very much. They gave it to them for 2 months. They didn't have them take anything for 3 months. They had a washout period. And what they saw was that the small, dense LDL particles, the ones that are more atherogenic that cause problems over time, which is small, dense LDLs, and urinary 8-isoprostanes, another oxidative stress marker, those actually went down. And then their oral glucose tolerance tests improved, and 4 out of the 6 patients with impaired glucose tolerance. So we saw that they're actually getting insulin, some level of insulin sensitization, as well as oxidative markers were improving, which are elevated in those that have metabolic syndrome and type 2 diabetes. It's really this, it's a fire that's out of control with a lot of these chronic diseases. Metabolic syndrome and type 2 diabetes is one of them, right? It's so pervasive, it attacks every single system. That's why diabetics, they have their kidney doctor, they've got their ophthalmologist, they've got their cardiologist, they've got the endocrinologist, they usually have me to help because they're just on a bunch of meds. So you can get them something like this. Because people have to drink water anyway, you might as well have some hydrogen water. These were open label studies, so not as strong as something that's blinded or placebo controlled, but better than nothing. And these were individuals that they had them drink 1.5 to 2 liters of hydrogen water a day, for 8 weeks, and they showed that superoxide dismutase and lipid peroxidation. So lipid peroxidation went down, SOD and antioxidant went up. And then here's another one where they looked at different lipoparticles, lipoproteins. So LDL went down, total cholesterol went down, ApoB100. You can remember B by bad. That is a marker. It's a lipoprotein that's on the LDL marker. It's associated with LDLs, and then ApoE also improved. What about those with liver disease? And which you don't necessarily have to have metabolic syndrome, but many people who do have metabolic syndrome and diabetes also have non-alcoholic fatty liver disease. It's just part of the pathogenesis. And here's 12 patients. They had NAFL. They just drank 1 liter a day of hydrogen-rich water for a month. And this was pretty impressive because there's, literally, a litany of interventions from the nutritional, botanical, dietary standpoint that can improve fatty liver disease. But usually they take a little while. This was just a month, and they already showed that 2.9% reduction in liver fat and their liver enzymes went down by 10%. That's not typically seen even with things like NAC and mixed tocopherols and tocotrienols and high-dose vitamin E that improve fatty liver disease, and the glutathione as well. Here was a 60-patient trial that had chronic hepatitis B. And so they did 30 people in the control group, 30 people in the treatment group, and they gave them this hydrogen-rich water. And of course, no surprise, right? Glutathione went up, superoxide dismutase went up, malondialdehyde, and xanthine oxidase. These are inflammatory markers as well as they are markers for oxidative stress. You can measure these in the blood. These also decreased. What about the world of, say, mental health concerns, psychiatric issues? Can it help there? And here was a study where they had a bunch of individuals who were diagnosed with anxiety, and they just gave them 600 milliliters of water, of hydrogen-rich water a day, 13 females, 13 males, or placebo. And then they had them rate on these subjective findings, like how do you feel? So they gave them different inventories. I think they might even they gave them a K6 score. And they showed that these people, just by drinking hydrogen water versus placebo, felt better. And it makes sense from a mechanistic standpoint because in a lot of mental health issues, anxiety, depression, schizophrenia, the list goes on, there's a huge inflammatory component to it. There's a gut inflammatory component to it. And this is a strong antioxidant. So it wasn't surprising to me to read this trial, but it's nice to see that the trial was actually conducted. What about exercise? So these are healthy individuals, had no health concerns, and they wanted to know if it could help with exercise performance, particularly, say, in high-end athletes where a lot of substances may be banned. So in these individuals, what they looked at was a double-blind, placebo-controlled crossover trial of 19 adults. And so they basically gave them a bunch of hydrogen-rich water, and then they placebo, and then they switched the group, and then they look at parameters over a period of time that they look at the study. So these individuals drank hydrogen water. They did an encapsulated tablet because it is hard to have a placebo in a hydrogen trial because your water either fizzes or it doesn't, right? It's either it's effervescent, got bubbles, or it doesn't. So here was one, what they did was how they blinded it. They actually took the molecular hydrogen tablet and they put it in a capsule and just had them swallow it. So the tablets in the two groups looked the same. So nobody knew if they were getting a placebo tablet or the hydrogen tablet. And then what they did was they had them just drink a whole bunch of water, and they did it the night before. And then once again, 30 minutes before, throwing them on a treadmill and making them run like, you know, hamsters on the wheel. And what they saw was is that their decrease exercising heart rate, respiratory rate, as well as at rest improved. So these actually, they had a respiratory rate and heart rate that was lower at resting, as well as when they made them run on a treadmill. So they did have improved exercise capacity. Here was one other one, very small trial, but they did it in high-end young soccer players, and they had them drink a whole bunch of hydrogen water, you know, 500 milliliters, at 10 p.m., 5 a.m., and 6:20. And then they just did a bunch of blood levels, and then they also looked at blood lactate, which is a byproduct when people exercise, which can contribute to muscle cramping and fatigue. They actually saw that muscle function improved, and all these other bad parameters also improved. So this was just another exercise study, and we'll go through one more. So here what they did was they actually took overweight people. They took a number of overweight women. I can't remember exactly how many, and they did this for a month. They gave them 1 liter of the hydrogen-rich water a day, and of middle-aged overweight women or placebo, and they basically made them do different types of exercises and looked at like VO2 max and all these other parameters that get researchers really excited, but us clinicians just want to know, did it work or not? Did it help or not? And what they showed was these people were unconditioned, overweight, middle-aged, and then they basically made them run around and do a bunch of stuff. And they showed that after 28 days, peak flow improved, hydrogen-rich water supplementation in middle-aged overweight women improved quality of life, and they actually had better outcomes as far as exercising longer, and more they said more endurance than those who drank the placebo. And then of course what's nice about this study is that they switched the two and they saw the same results. So the group that had the hydrogen water went on to placebo. They didn't do as well as then when they did the first time they had the hydrogen. So we know it actually works. So, and I actually, before I go running every morning, I drink, I don't drink 500 mils, I drink more like 8 ounces. It's hard for me just to slam 500 milliliters, and we'll talk about that at the end. So here's kind of like your capstone, right? The bird's eye view of my crash course on all the accolades of molecular hydrogen and its effects, right? So you got all this high oxidative stress, pounding on your cardiovascular system, but if you take molecular hydrogen, it helps improve antioxidant status, it's anti-inflammatory, helps with signal modulation. So if something needs to be upregulated, it does. If something's downregulated, it does that. So it creates a homeostasis in your body. It's also a cell protectant. So the question is then, why Allergy Research Group oral molecular hydrogen? It produces higher level of molecular hydrogen in water than a lot of the other tablets on the market, or water ionization, and 2 to 10 parts per million. The reason that is because of a couple of reasons. Molecular hydrogen is hard to test because it's a gas. So you have to kind of get closed containers, and you have to have the right meter. It's got to be calibrated. And there's only a few research labs in the world that know how to accurately test it. The other thing has to do with the way it's made, right, is that it's made by water molecules. So, for example, some people in the United States, American mentality is more is better. So some people say, well, what if I have 8 ounces of water and we drop in 2 tablets? Will I get more hydrogen? The answer is no, because you can only saturate the water molecules so much. So dropping in 1 tablet with 8 ounces of water, you're really going to get its max capacity. Also, the second those bubbles hit, it's a gas. It's automatically breaking down. So the key is, you drop it in there. This is what I tell my patients, or people in our research group, is that when it's almost finished dissolving, just give it a gentle stir, and the person does have to drink the water as quickly as they can, because if they wait 5 minutes, there really is not drop them in a glass and then drink it. It's not possible to take too much, right? So you can't overdose on hydrogen because of the gas. Your body will absorb what it needs to, and the rest actually comes off your breath. It doesn't smell or anything. The caveat would be if people are going to be doing the small intestinal bacterial overgrowth test, the SIBO testing, where you're testing methane and hydrogen, they can't be drinking this for, a week or two before the test or the day of the test, because then you get spuriously elevated hydrogen values because of the hydrogen you're actually drinking. There are over, like I said, there are over 1,300 studies, and at this point, at least when I wrote this a little while ago, there were 170 human animal disease models on molecular hydrogen, and it balances redox. Some people ask about the hydrogen producing machines and the generators, and I'm not an expert in molecular hydrogen, but Tyler Barron is, who you saw some of his studies and his references, and he actually donated the slides on the mouse study to me. He said that the generators just don't generate enough hydrogen to make a therapeutic dent, because hydrogen is an extremely combustible gas. So if you try to get these machines to make more hydrogen that make them therapeutic, they would probably explode, is what he said. So it's super dangerous. And then IV hydrogen, you really, really need to know what you're doing. I don't even know anybody that does them. I'm sure there are people that do them, but it's risky. Like putting anything into your vein is risky. So what's an easy way, right? If you have to drink water anyway, you're gonna die. So you might as well throw a hydrogen tablet, wait 2 minutes for it to dissolve, and then drink it. And it does kind of, it's a drawback, right? That you can't sip your water throughout the day. You have to drink it all at once, or you don't really get any benefit. So for those of you who want to know more, Allergy has nothing to do with this. This is a nonprofit group that is here in the United States, but it's worldwide, and it's the Molecular Hydrogen Institute, and they're always putting new studies up. They always have, kind of blogs, and they have meetings with great minds to present more and more research on hydrogen and how it can work. There are some studies showing it not to treat COVID, because that has not been proven, but it has been shown in some trials to help those who've been infected with COVID, help alleviate some of their respiratory distress. And I've had some patients with COVID that I put them on this, and it helps with their breathing, helps with their energy, helps with their mood. And they were usually on it anyway before they got infected. So I would say thanks for attending, and I can open up the floor to any questions if anybody has any.
Yeah, is there a better time to drink hydrogen water? During the day, during the evening?
It seems to be a lot of these studies were done in the morning, but with my patients, I usually have them drink it when they get up in the morning versus reaching for more and more coffee. Same thing with the time where, say, the post lunch malaise, people are faded out, they're tired, it's like 2 p.m., they still got 3 hours, 4 hours left to work. I have them drink the hydrogen again, or green tea or something like that, and or as well as adaptogenic herbs. So usually for me, it's morning and then early afternoon, because some patients, when they drink before bed, they're like, thanks, doc, because now I'm kind of awake and I want to go to sleep.
Yeah, that's what I was thinking. It seems like it would, give you energy through oxygenation. So
yeah,
that was pretty fascinating. I didn't know a lot about hydrogen water, so thank you. And Joe said, can he put it in his espresso? Joe puts everything in his espresso. He puts lymphatic tincture, protein powder.
Well, he is Italian, so no, Joe, you can't put your hydrogen in there. It needs water. And then there's a debate whether you need filtered water. And they've done these tests where they've done filtered water, Evian, cold water, room temperature water. And the most hydrogen that seems to be produced is just plain old, not even distilled, just plain filtered. Unless you live in an area that has really clean water, you can use tap water. Room temp water seems to produce more hydrogen than when it's cold.
Okay, so temperature may affect it as well. Well, that's fascinating. Yeah. Well, thank you so much. And these are available, right? So the tabs are available at the Weiner Wellness Center. So you can pick these up here all week. And Dr. Bourne, I appreciate you being here and taking time out of your schedule. Thank you very much.
Appreciate it. Thank you. Take care.
All right, guys. Thanks so much, everybody, for attending today. We had such great information. And tomorrow we are going to do it all again. So tune in tomorrow at 8:30 a.m. for morning commentary. And we have a whole list of people on the bracket. Let's take a look just real fast so we know what's coming up. Tomorrow is Wednesday, so May 12th, 8:30 morning commentary, 9 o'clock. We have Dr. Len Bransowitz, who's a PharmD, ND, MD. He's going to be talking to us about the Candida connection and using common sense. 10 a.m. is Mark Mangieri. He's the guy responsible for those delicious brownies we were talking about this morning. Hemp-based cannabinoids and nutraceutical formulations. Jeff Nisnik is back again with Lyme and other chronic illnesses and natural solutions. Our roundtable, we're going to break down who is liable for these jab mandates. What about companies, organizations, colleges? We're just going to have an open debate on that and discussion. And then finishing off our day tomorrow is Dr. Joseph Honigman from the Weiner Wellness Center. Don't stress out, how to make stress and have it work in your favor. He started with part 1 already and taught us all about what stress does in the body. And this time he's going to help us make it work in our favor. So thank you so much for joining us today. I appreciate everyone being here. Remember to call the Weiner Wellness Center, get your supplements, 30 to 50% off. And if you found this information valuable, tune in tomorrow, tell a friend, join our mailing list, like our Facebook page and our YouTube page. And we'll see everybody back here tomorrow morning at 8:30 a.m. Eastern Standard Time. Thanks for joining us, guys. Have a great evening, and God bless you.